In the 51 years since the first successful heart transplant in South Africa, there have been significant advances, changes, and innovations in the field of organ transplantation. However, since 2010, the average number of organ donors in the country has remained less than 2 donors per million people. This is among the lowest in the world.
With the triple burden of disease in South Africa, of HIV, hypertension and diabetes, there are countless patients that will develop end-stage organ failure, where receiving an organ transplant provides them with a definitive therapeutic option. There is not only a national, but a worldwide increasing need for organs, and the demand far outweighs the supply.
Preliminary findings in an ongoing multi-center study looking at factors influencing organ donation consent rates suggests there are multifactorial reasons at play. Lack of education and accurate public awareness regarding organ donation continue to be implicated as factors in several studies across the world. In a South African study, lack of knowledge among medical students has also been implicated.
So obviously the heart, cornea, kidneys, you can take the liver, lungs. I know there's like 7. Yeah, there's 7. Skin, yeah, you can take skin for like skin grafts.
I think statistically it's quite a low number, simply just because, first of all, not many people know about organ donation.
Well, on one hand, it's people with religious and cultural beliefs, and the other barriers I think are just education and information.
Furthermore, I think the process of how to donate organs is not clear enough. I don't think there's structures in place for people to make it readily available. And also I think there needs to be more of an acceptance, more of a culture created around organ donation.
Because I think it can just extend people's lives, and we owe it to them to not throw organs in the dustbin when they can still be put to good use.
My name is Kanyisa Pinda. I am a 24-year-old medical student at the University of Cape Town, but I also recently completed my BMed Honours in Medical Biochemistry. My research was looking at the effects of ARVs on the placenta. I am also currently on the heart transplant list, and I've been on this list for the past 2 years. In 2013, I was diagnosed with dilated cardiomyopathy, condition whereby my heart is bigger or enlarged than what it's supposed to be. And since my diagnosis, I've had a lot of limitations, primarily being the fact that I cannot be involved in any physical activity because I struggle a lot. Secondly, I struggle a lot with concentration as well. And another limiting factor since being on the list has been the fact that my life has sort of been restricted to the fact that I cannot go anywhere I want, I cannot do anything I want to do. I constantly have to update the transplant team about my life, and those have been the greatest limitation. I would like to encourage people to become organ donors and to discuss and express their views with their families, so that people like me with illnesses and conditions that we have no control over can continue to achieve our goals. There is a free online course on organ donation aimed at professionals, graduates and students in the health sector and those out of it. Follow the link below. Educate yourself, then educate others. A heart transplant is not my last best hope. People that are and become organ donors are my last best hope.